Section 1, the goal of sterile dressing changes. This lesson shows how to do a sterile dressing change. The main goal is to keep the wound clean. We want to protect the wound from germs. Germs can cause infection and slow healing. A clean wound heals faster. This guide gives simple step-by-step instructions for nurses and presenters. We will create and maintain a sterile field. If it's contaminated, we start over. Aligned with standard nursing practices tested by ATI. We use teach, pause, perform. With time built in for you to demonstrate, you'll be ready in about 12 minutes. Before any procedure, prepare. I'm here to change the bandage to help it heal and stay clean. Is that okay? Obtain consent. Position for comfort and clinician ergonomics. Ensure privacy and good lighting. Gather all supplies on a clean, dry surface. Sterile kit, sterile gloves, sterile gauze, cleanser, antiseptic if ordered, medical tape, clean gloves, waste bag ready. Protect linens with a pad. Add sterile scissors, forceps, skin barrier, adhesive remover as needed. Verify orders, allergies, dates, and intact packaging. A safe, organized setup makes everything smoother. Perform hand hygiene. The most important infection prevention step. Use soap and water or alcohol rub with proper technique. Clean, non-sterile gloves to remove the old dressing. Add mask, eye protection if splash risk. Wear a gown if needed. Protect bed and keep area clean. Touch only the outer edges. Avoid crossing over the sterile interior. Place the inner sterile container on your clean work surface. Open sterile drape by the 1-inch border. Let it unfold without touching other items. Add sterile items carefully. Keep the field in sight and above waist level. Keep moisture off the field. The outer 1 inch is considered contaminated. If the field is contaminated, discard and start over. Attention to the sterile field protects the patient from healthcare-associated infections. I will remove the old dressing gently. Tell me if you feel pain. Pull tape slowly, parallel to skin, supporting the skin. Use adhesive remover for very sticky tape. Moisten stuck dressings with sterile saline. Do not force. Let saline soften dried drainage, then lift without trauma. Keep contaminated surface away from the patient in clean areas. Note color, amount, consistency, and odor. Small clear versus large, thick yellow drainage. Remove gloves using proper technique. They are contaminated. Dispose immediately. Perform hand hygiene again before sterile steps. Now I'll don sterile gloves to keep the field completely clean. Open outer wrapper, handle inner by edges. Inside surface and gloves are sterile. Touch only the inside cuff. Keep thumb tucked. Then adjust fingers as needed. Keep hands above waist and in view at all times. Assess wound bed and surrounding skin. Note size, note depth, identify tissue types. These may signal infection. Note type and amount. I'm checking size, color, signs of infection. Pour cleansing solution as ordered. Use new gauze for every pass. Always clean from cleanest to dirtiest, then each side away from wound with new gauze. Do not return used gauze to the center. Keep used items off your sterile field. Be gentle but complete. Avoid moisture on sterile field until in use. Communicate throughout. Confirm debris removed and skin intact, ready to dry the peri wound. Pat, don't rub. I'm gently drying the skin so the new dressing adheres. Apply barrier where tape will go. Allow to dry. This film reduces skin injury at next removal. Choose size, type per order. Open without contaminating. Handle only with sterile technique. Cover wound fully with healthy skin margin. Create a good seal. I'm placing the new sterile dressing now. Tear tape pieces before applying. Avoid taping over the wound or irritated skin. Label for continuity of care. Ensure it's not too tight. I'll secure with tape and check it isn't tight. Remove gloves. Perform hand hygiene again. Hand hygiene after procedure. Dispose in biohazard bag. Seal it. Sharps go to sharps container. Leave the area clean. I'm finishing cleanup and washing hands again. Reassess comfort and safety. Document date, time, assessment, solution used, dressing type, tolerance. Be specific and timely. Tell them who to call. Keep dressing clean and dry. No next change or follow-up. Provide written steps if self-care.